Myasthenia gravis is an autoimmune condition that causes muscle weakness and gets progressively worse with activity and improve with the rest. Interestingly, my gravis affect men and women at different ages. So a typical patient is either a woman under the age of 40 or a man over the age of 60. There's strong link with myasthenia gravis and type momas, which are tumors of the thymus gland. Around 10 to 20% of patients with myasthenia gravis will have a thymoma, and around 20 to 40% of patients with the thymoma will develop myasthenia gravis. How do patients present? The severity of symptoms between patients can vary dramatically and can be mild and subtle in symptoms of it can be life-threatening severe. The characteristic feature is weakness that get worse with increased muscle use and improve with rest, so symptoms are typically minimal in the morning and worse at the end of the day. Symptoms most affect the proximal muscle and small muscle of the head and neck, so this leads to extraocular muscle weakness, which cause double vision. We call this diplopia eyelid muscle weakness, which cause dropping of the eyelid, and we cause dysbiosis. Weakness of the facial movement. In swallowing, we can get fatigue in the jaw when they chewing food, and they can develop slow speech.
EMG test procedure. There are two components to EMG test: the nerve conduction study and needle EMG. The nerve conduction study is the first part of the procedure. It involves placing small sensor called surface electrode on the skin to access the ability to the motor neurons to send electrical signal. The second part of the EMG procedure, known as a needle EMG, also use sensor to evaluate electrical signal. The sensors are called needle electrode and directly insert into muscle tissue to evaluate muscle activity when at rest and when construct. The nerve conduction study is performed first. During this portion of the procedure, the doctor will apply several electrodes to the surface of your skin, usually in the area where you experience symptoms. This electrode will evaluate how well your motor neurons communicate with your muscle. Once the test complete, the electrodes are removed from the skin. After the nerve conduction study, your doctor will perform the needle EMG. Your doctor will first clean the affected area with antiseptic. Then, they will use a needle to insert electrode into your muscle tissue. You may feel slight discomfort or pain while the needle is being inserted. The needle electrode will evaluate the electrical activity of your muscle when construct and when at rest. This electrode will be removed after the test is over. During the both part of the EMG procedure, the electrode will deliver tiny electrical signal to your nerve. A computer will translate the signal into graph or numerical value that can be interpreted by your doctor. The entire procedure will take between 30 and 60 minutes. Other tests that can help your doctor diagnose the condition include: firstly, repetitive nerve stimulation test. Second, blood testing for antibodies associated with MG. Thirdly, a ruthenium test. A drug called tensilin or the placebo is administered inversely and you're asked to perform muscle movement under doctor observation. The last one is a imaging of the chest using CT scan or MRI to rule out the tumor.
Treatment option: first, reversible acrolein transferase inhibitor with the primary dose treatment or neotreatment increase the amount of acrolein in the neuromuscular junction and improve symptoms. Second, immunosuppression prednisolone or azathioprine suppresses the production of antibodies. Next, thymectomy can improve symptoms even in patients without a thymoma. Monoclonal antibody rituximab is a monoclonal antibody that targets B cells and reduces the production of antibodies. It is available on the NHS if standard treatment is not effective and certain criteria are met. Next, itolizumab is a monoclonal antibody that targets a complement protein 5. This could be potential prevent the complement activation and destruction of acetylcholine receptor. There is ongoing research and debate about whenever the evidence is strong enough to offer it on the NHS. It is currently not recommended by NICE. The conclusion, Myasthenia gravis, especially when associated with pregnancy, is a high-risk disease, and its cause is unpredictable. Several life-threatening conditions might occur, especially due to generalized weakness, in particular respiratory insufficiency in the green, the parturient, as well as the newborn. As this disease predominantly occurs in women of reproductive age, it is important to be aware of this condition and its interdisciplinary diagnostic and therapeutic management.